Well, I think what we need to do, we know the data now, Meg. It's not a secret that with many diseases, but a bright light is being shined on this with COVID, is the disparities in health and in health care. I mean, when you look at the social determinants of health and you look at the background, particularly of minorities and people of color, they have two things that are making them suffer more. On the basis of the social determinants of health, they are often put in a position from a socioeconomic, geographic, employment standpoint where their ability to protect themselves from the coronavirus infection may not be the same as someone who has the capability of sitting in front of a computing and teleworking. And yet when they do get sick, the underlying predisposition to complications because of comorbidities, there's a much higher rate, prevalence, and incidence of the kinds of comorbidities that give you a greater risk for serious disease among minorities, particularly the African-American population. That's diabetes, that's blood pressure increases, hypertension, that's obesity, and a variety of other conditions. So what we need to do as a society immediately is to make sure that the resources to give them the best possible chance with identification, isolation, and contact tracing to prevent the spread within those populations. But we need to have a long-term commitment to address these disparities of health that have been with us well before we had the challenge of coronavirus. So we have an immediate and a long-term goal and responsibility, really.
And are you seeing that work get underway now? Or are you optimistic that will change?
I am, because it's very clear of what's going on right now. And when we do programs like develop clinical trials for vaccines or clinical trials for therapeutics within the context of COVID, we are now paying a lot of attention to make sure that there's adequate representation of minority communities in those particular trials so that they have access not only to the advantage of whatever potential benefit might come from that trial, but also we learn how best to treat and prevent disease in these populations. So we're paying a lot of attention to that.
Well, I want to ask you about clinical trials and specifically of vaccines. President Trump this morning said that there are 2 million doses ready of vaccine, ready to go as soon as the safety checks out. Can you tell us about what he was referring to?
Well, I didn't hear him say that, so I'm going to use my usual experience with the press of not commenting on something that I haven't seen myself. But let me give you the facts about vaccines in general. We're cautiously optimistic that we will be able to get into a phase 3 trial with at least one candidate in early July and a few others as we get into the summer and early fall, which means if things work well and we don't have any unanticipated bumps in the road, that we can have an answer as to whether or not a particular vaccine candidate is safe and effective by the end of the calendar year and the beginning of next year, which would mean that if that were the case and we simultaneously produce doses of vaccines right now, that we could have available substantial amount of vaccine by the end of this calendar year and the beginning of the new calendar of 2021.
Scott?
Scott Wapner, I appreciate you being on our program again. I have a question for you. It's nice to see that things are going in the right direction, as you say. But at the same point, we are still in the midst of an epidemic. We have 20,000 new cases per day. Those are diagnosed. Some suggest the numbers are actually much higher than that. Yet the White House task force on the coronavirus hasn't had a public event since April 27th. You haven't spoken publicly from the White House since April 29th. It's left some people wondering why. What would you say?
No, I mean, I think that what you're seeing out there publicly doesn't really reflect what's going on. We meet frequently. I was down there the day before yesterday. We have a meeting today at the White House. Just because you don't see the public press conferences does not mean that there's a lot of activity going on and a lot of attention paid to what we do. But I could understand how you might come to that conclusion. But I think there really is a disconnect. The seriousness with which the task force takes and the effort that we put into this is really substantial. Even though numerically the number of meetings might be less, the activity is still really quite intense.
The CDC yesterday said that it was concerned that people aren't necessarily following their guidelines on distancing and masks. And I'm wondering if you share some of those same concerns, Dr. Fauci.
Well, I mean, I think what they might be referring to is that one of the concerns that all of us, the health officials, scientists, and physicians are concerned about is that when you have crowds of people together and you have the lack of wearing of masks, that increases the risk of there being transmissibility. There's no doubt about that, which is the reason why the common denominator of many of the guidelines for mitigation are physical distancing as well as wearing of a mask. And when we see that not happening, there's a concern that that might actually propagate further spread of infection.